Aloha and welcome to Upside Down Pilates and Nourishment. My name's Lisa Orrick, the creator of the Joint Pain Eliminator program, where I help women eliminate joint pain so they can live a pain-free life and bring their body to a level of strength and power that they've never thought possible. Today, we're going to look at the hip. We're going to look at the anatomy of the hip. We're going to look at some problems that happen in the hip, and then we're going to learn a basic hip strengthening sequence and then an intermediate level hip strengthening sequence to help diminish and eliminate the joint pain in the hip. So let's start with some anatomy. We're going to come over here and talk to Herman. He's with us again today. And let's look at what the hip joint is. So we'll do a little bit of a review. So we talked about our back a little bit, we talked about our pelvis a little bit, and we talked about our sacroiliac joint. So our back connects to our pelvis through the sacroiliac joint, and then the other end of our pelvis is our hip joint, okay? So if you can see this on Herman on the side, this little circle down here, this is called your acetabulum. And this is where your leg bone connects into, which is also called your femur. So I'm going to pull Herman's limb up here. So this is the femur bone. This is called the head of the femur. This is the greater trochanter. This is the lesser trochanter. And it's a ball and socket joint, and this ball sticks right inside that socket, okay? And it should be nice and snuggly and happy in there. And then around the outside is something called the labrum, and it is a big circle of connective tissue around the outside here. So it's snugly in there, held in place by the labrum, and there's cartilage on this end, and then there's cartilage on this end. So the movements here we can go flexion, extension, abduction, adduction, circumduction. All right, these are all the words that the scientists have come up with to label how our legs move. And then we also use them when we're analyzing movements. There are a lot of muscles at our hip, and I'm not going to go and tape every single one today, but we have, I forgot some movements. Lateral rotation and medial rotation. Sorry about that. Okay, so some of our hip joint muscles that we have in the front, we're going to have a psoas muscle, so that actually connects our spine down into that lesser trochanter. We have a hip flexor muscle called the rectus femoris, and that's going to connect down right here up at our ASIS, and then it goes down, and it actually connects over through here on our patella to the front of our lower leg bone, our tibia. And then we have some outside muscles that do abduction here. They connect this up onto this bone here, the gluteus medius, the minimus, the gluteus maximus. Our tush muscle connects all the way through here down to our sits bone. What other muscles do we have here? We have inner thigh muscles. So we have the pectineus, the adductor magnus, minimus, all of these muscles in here, and they connect all the way through the inner thigh onto the pelvis, but then also down to the end of the tibia at the bottom. We have 6 deep lateral rotators. So the lateral rotators connect this bone up, down, over to here somewhere in our pelvis. There's 6 of them. The piriformis, the gemellus inferior, superior, the obturatus internus and externus. And then the sartorius is another muscle that comes across the front here and helps turn our leg out a little bit. And then, of course, our hamstrings. We can't forget them. They come down from our sits bones, and they connect down to the back of the femur or to the tibia or around the front of the knee here. Anything else that does the hip joint? Not off the top of my head. So we've got a lot of muscles in our hip. And what that means is it's very easy to have some imbalances in our hip. Some things that go wrong in our hip, one of the things that can go wrong is we'll have some sort of a labral tear. So I talked about how there's that circle of connective tissue that sticks the head of our femur right into the inside of the acetabulum. That can get clipped or can tear a little bit. So that can come from an injury, falling or something like that. It can also come from repetitively using the joint in a pattern that isn't great for the hip, and it will get kind of clipped. It can happen in the front, the side, the back, all over the place. Another problem that can happen is you'll get arthritis in your hip. So the arthritis in the hip, you will wear down the cartilage either on this end or both. So remember I said there's cartilage in there. That'll wear down. Then you have bone on bone and some inflammation, and that will create quite a bit of pain. Those are two of the main ones. There's a lot of different things that can go on in there, but those are two of the main ones. And then I wanted to share with you just briefly what a hip replacement is. So they will actually take off the head of the femur and take off some of the inside of the acetabulum, and then they'll screw in titanium is what they use mostly now. Titanium side of this socket and titanium ball, and they kind of drill it down into your bone and anchor it, and then they bring this back up into here. So that is what a hip replacement is. My goal is for you to not have to have one of those. So we have to have good, happy, healthy movements in our hip joint. In addition to that, we need to have a lifestyle and a diet that helps support the health of our cartilage and our connective tissue and our bones and our muscles. So all of those things play into the health of the hip, not only the movements, but also the diet and the lifestyle factors that contribute to our connective tissue and bone and muscle health. So when we start to talk about stabilizing the hip, we have to start with our spine and our torso. So in order for us to actually get in and strengthen the hip and stabilize the hip, which I'm talking about this joint right here, our torso needs to be stable and strong. So we've already been through that. In the last two sequences, the sacroiliac joint that we talked about this, and then the lower back sequence, we talked about this. So we have to work on that first. Then we can go down into the hip and start working on that area. But primarily, we have to start with the stability in our pelvis and our spine first. The other thing that happens is when there's a problem in our hip, just like in our spine or in our sacroiliac joint that we talked about, it's generally you're feeling the pain in the hip, but oftentimes there's a problem somewhere else. But you're starting to feel the problem in the hip joint. So what happens with this is I'll try to show you on Herman. If your ribs and your spine are shifted over to your left, you may actually start to have problems in that right hip area. But it's because of the shift in your ribs or your spine in the opposite direction. So in order to really go back in and take the pressure and the pain out of the hip, you also have to bring yourself back to center, bring that left side back to center, and connect it back into the right hip. That's a very common problem. So there's oftentimes a cross-lateral connection of the issue that's going on. The other thing that can happen is the hip will be unstable, and you'll actually start to feel pain in the knee. So I'm going to try and show this here. So this is our knee, the end of our knee, and our patella, our kneecap. If our hip, for some reason, it comes across like this, our leg bone comes across from our hip, you may start to feel pain on the knee, either the inside or the outside, Or if the leg bone goes out like this, you may start to feel pain in the inside or the outside of the knee. So these are all different misalignments that can start to create problems and pain inside of the hip joint or in other areas because the hip joint is weak and unstable. What we're going to do now is learn a basic sequence that we can do to start strengthening and stabilizing the hip. And of course, we're going to start with our breath, and we're going to start with stabilizing the pelvis first, and then move into some of these other hip muscles. Get Upside Down Pilates uninterrupted with no commercials or ads. You can watch all the full 1-hour episodes of Upside Down Pilates on all your devices. Visit www.upsidedownpilates.com to sign up now.